Hello, I have the amazing
Dr. Maryssa Portelli.
Yes. I would like to ask you a few questions. So how did you come about working with patients with Prader-Willi syndrome?
So I am the consultant psychiatrist who works at the Royal Prince Alfred Prader-Willi service. Before that I was an intellectual disability psychiatrist who saw the occasional person with Prader-Willi. But my research is into prescribing cascades and people with intellectual disabilities and rare genetic conditions being put on inappropriate psychiatric medications. And so the wonderful Professor Tanya Markovic asked me to see a few of her Prader-Willi patients, and through what's now probably about a year and a half of chasing money for a clinic, we now actually have a proper psychiatry clinic. Much of my work is about dealing with the neurobehavioral manifestations of Prader-Willi, non-pharmacological and pharmacological management, and trying to reduce the harm that we're doing with medications and kind of multiple combinations of medications for people who have Prader-Willi to try and have their best quality of life. A lot of the kind of difficult transitions through life, so going from primary school to high school, going from school to TAFE, moving into supported independent living, are often times where a psychiatrist needs to get involved just for scaffolding and planning, and just preventing things from getting to a crisis situation where you're needing to go to ED or needing to have police involvement. So a lot of it is about planning for the future and managing the behaviours in the best way possible. We also know that people with Prader-Willi are more likely to have a mental illness, more likely to have psychosis than the general population. And it's about having somebody who understands behaviour baselines, understands what medications need to be used for Prader-Willi to prevent actual harm from the treatment that we're doing.
And could you describe maybe one word or a sentence what you give to families?
I think most of my patients talk about peace of mind. Is that in our sessions we often talk about planning for the best days and the worst days, and having that peace of mind to know that there's a plan, there's a clinician they can talk to, there is a written plan that they can take to the GP or the emergency department if something does happen, does actually decrease the amount of stress within the family unit. I think that families are often surprised to hear that things are common, and not necessarily a problem. So often there are behaviours that we can have a reaction to within Prader-Willi that actually is not harming the person, is not harming anything around them. I think being told that their child is not weird, not crazy, not needing to go to a psychiatric unit is actually a big relieving thing. And for the vast majority of cases, they're not. Is that they just need a little bit of supportive care and actually to get on with their lives. And I think that that's what parents are seeking. And often I meet parents who've been given their child's been given an inappropriate diagnosis in the emergency department, maybe by a mental health practitioner who doesn't understand about Prader-Willi. And it's a lot about walking that back.
How important is psychiatry for patients with Prader-Willi, and how early should they intervene?
So much of the management of the neurobehavioural symptoms is done by a developmental paediatrician initially in the first, say, 12 years. We see patients from 12 and up at RPA, but often intellectual disability psychiatrists may see 15 or 16 and up.